Mastalgia, or breast pain, can have various causes, ranging from hormonal changes to underlying medical conditions. Here are some common causes of mastalgia. Hormonal changes. Fluctuations in hormone levels, particularly estrogen and progesterone, can contribute to breast pain. This often occurs during menstruation, pregnancy, menopause, or hormonal therapy. Breast tenderness. Some women may experience breast tenderness or pain as a normal part of their menstrual cycle, typically occurring in the days leading up to menstruation. Fibrocystic breast changes. Fibrocystic breast changes involve the formation of benign lumps or cysts in the breast tissue, which can cause breast pain or discomfort, especially before menstruation. Breast trauma or injury. Trauma or injury to the breast, such as bruising or strain from physical activity, can lead to localized breast pain. Breast infection, mastitis. Mastitis is an infection of the breast tissue, often occurring in breastfeeding women due to milk duct blockage or bacterial infection. It can cause breast pain, redness, swelling, and fever. Medications. Certain medications, such as hormonal therapies, oral contraceptives, or hormone replacement therapy, may cause breast pain as a side effect. Breast surgery or procedures. Breast surgery, including breast augmentation, reduction, or biopsy, can lead to temporary or persistent breast pain as part of the healing process. Costochondritis. Costochondritis is inflammation of the cartilage that connects the ribs to the breastbone. It can cause chest pain that may radiate to the breasts. Muscle strain. Strain or tension in the chest muscles, often due to poor posture, heavy lifting, or vigorous exercise, can result in breast pain. Psychological factors. Stress, anxiety, or emotional distress can sometimes manifest as physical symptoms, including breast pain. It's important to note that while mastalgia is often benign and temporary, persistent or severe breast pain should be evaluated by a healthcare professional to rule out underlying medical conditions, such as breast cancer or other breast abnormalities. If you experience new or concerning breast pain, it's advisable to seek medical attention for proper diagnosis and management. Consult Professor Zahid Mahmood at Hameed Latif Hospital Garden Town for treatment, or call on 03 413 59 for an appointment.